Mochana, Dr. Nitya. Good, nice meeting you all. This is one of the important topic to discuss on the essentials of adolescent parenting. What is this anticipatory guidance? We heard of anticipatory bail, but I didn't know about anticipatory guidance. Of course, when I asked somebody, they said that okay, this kind of guidance is required. But when I asked some little older ones or elders in the family, not required. We just follow the guidelines what they say, but with the growing problems of suicide, depression, substance abuse, lot of things, and I think we should have a guidance to our parents, because with the globalization, urbanization, industrialization, working parents, this kind of guidance is definitely required to prevent our adolescent, whatever the risk they are undergoing or the crazy years of their life. That's what. Let us discuss about this topic in few headlines. That is about one is we talk about physical and psychological changes always, but we should reinforce an annual health checkup, which we don't do. Whenever we get a chance for the immunization, or at least once in 6 months, once in a year, they should visit the doctors. Like it's not that adolescent, wherever they go, even primary health doctor, they should visit and they should examine themselves, physical or mental status or whatever the problem. That's very important. We should reinforce as well as vaccination too. Apart from that, we should little discuss about styles. We can't figure out the types and patterns of parenting style, but still we can define the parenting styles and positive parenting. Important is communication, which is lacking very highly, and we should focus on high risk behavior of the children, and for that how to overcome that and what is our role, and we should check it with the flag signs, where especially when it comes to mental disorder. What is this positive parenting tools, and what are the types of parenting? There is a it is a evidence based classification done in majority of the whatever the research article. uh, well, let us discuss about this. What is positive parenting? That's very good actually. Here the parents are very warm, supportive, encouraging, and they're good with everything, warm, supportive, encouraging, but they are firm. They are firm with their ideas, their policies, and they are consistent with their policies. They know where to extend their boundaries or where to limit their boundaries. That is the beauty of that positive parenting. And they have, what do they do? They highly nurture the patients, children's. They have good expectation, which is required, and they do have a mutual respect. What is the impact on the children? Children grow comprehensively. They are accommodative, accepting. They're in the society. They have their norms, and they, for any goals, they never say no. Their scholastic performance is good. Overall, they'll get involved in all the social activities, household activities. They'll try to be grow as a very nice child. That is a good thing about positive parenting. But we do see dominating parenting where they are like a military parenting. They they are like tiger, and they'll be always commenting, abusing, and their rewards are final, and they got poor listening skills. And what happens? They with the children, and what will impact is they have low nurturance, and for the nurturance is poor, and they have high expectation, and mutual respect is also no. So in this case, what happens with the children? They do better. They do better in their academics, if at all, but they have other things. Their acceptability and adjusting to the social society or the goal setting, they have got lack of whatever the skills attaining. Life skills also poor, and they do suffer. We have seen that the studies have shown, many international journal of health adolescent academia has shown they land up with this kind of drug abuse, sexual abuse been seen with patient parents, with dominating parents. So we should know where to manage them. Out about other things, other permissive parenting, these are all the, they are very good. They want to be good in the society. They want to be good with their children. They want to be the sophisticated. They want to, doesn't want to get involved in the conflicts, and they set up the rules. Sometimes doesn't do. They want to be pal rather than more than the parent. Here the nurturance is good, and they'll nurture, but expectation is very low, and they have moderate respect. So what happened to these children? What is the impact? The children grow nicely. They have very good social skill. They have very good emotional skill. But when it comes to academics or the performance, there been the reports are shown that they doesn't match up with the goals or the standards, or doesn't well, when it comes to the achieving our other targets, they do perform not like other children, not like positive parenting. That is with the permissive parenting. but overall they will not be like, so much deteriorated in their whatever the life achievement. But very bad is unengaged parenting, where they'll poor monitoring, poor love with the children, lot of conflicts in the family, not understanding. They and always they have separation, parental separation. Here all nurturance is low, expectations is low, and respect and they have mutual respect is also low. The impact is positive impact. Sometimes these children they overcome because of these repeated problems. They overcome, they may have their own style of living, and they may lead a good life, but not majority they land up with other problems also. Or they may try to get this love from others, or other parents, or somebody in the society. Maybe that's a good or bad, they'll not be knowing. And the failure rate is very light, especially family life, social life, or the scholastic or academic, or even in the workplace. Their performance is not adequate, like another other thing, and very high chances of they becoming antisocial. So these are all the parenting. What mainly it is the positive parenting. What is positive parenting? It is the unconditioned love, nurture with warm and encouraging facilities, encouraging mode, and set a discipline where it is flexible when it is required, or when it is strict, they have to be strict. Set and reinforce it, and we should be the role model when it comes to discipline. Important thing is we should allow the parents, as a parents we should respect the society, family, elders, and they do the same. Mutual respect should be maintained, and opinions and beliefs should be we should be role model. And we should by doing all these things, positive parenting, it is not that we should not allow their freedom, we should respect their privacy too. That's about positive parenting. What happens with positive parenting? Their academic performance good, their achievement is good, they're good in sports, music, and other activities, and very less rate of or decreased rate of depression, stress, anxiety, suicidal tendencies, and other things. Risk behavior, risky taking behavior is also less, and they have got accommodative, accepting skills are better, and they are mutually respecting, especially when it comes to emotion quotient, accepting or going with the society norms. They are good, and conflict, they know how to manage the conflict easily and comes out of the conflict too. And for all these things, to maintain the good parenting, very important is communication. There's a very good tool that we know already. It is two types of skill. Many are there, but majority it is verbal and non-verbal. So what is that verbal is? We should make that. We should utilize the time to communicate with them properly. For that communication, we should have the tone should be proper. We should have empathy. We should have some amount of hilarious moment. And mainly, main thing is we should listen to them more than talking, giving our opinion. We should allow them to be come out of their ideas, and it should be accepted. And anything modification, it should be softly addressed. That is very important when it comes to the verbal talking. Of course, we can use whenever necessary non-verbal, like with our body language to say no or yes, or through media, or by writing few lines. Now, what is that? Factors comes in the way of communication. It is the two-way. Like team factors affect the parental factors affect the team factors. Both if they doesn't have a mutual understanding, the communication will become non-communication. What are the team factors? They have now with all the problems of a growing media, all those things are their own problems. They'll not be interested to listen to the parents and not ready to confide to the parents. Like they prefer the friends over the teens. And because whatever the reason, because of the thoughts, the age, or overscheduled routines, coming to the parents, both the working parents, and they doesn't communicate each other, and lack of they doesn't have lack of knowledge about going developmental aspect, and too busy with to find that time to talk. They'll say, okay, we'll see in the evening, or you're talking too much, or now you are above your head. All those words comes when a teen approach them also. All these factors affect their communication. So parenting in all, it is a good parenting as well as good communication will lead to good parenting. So what are the communication tips for the good communication? As I said, listen more. Good listening is a power, and talk less. That is very important. And whenever I get opportunity, open the topic, allow them to speak, and have a ventilation in between. Use open-ended question. Don't abruptly stop there. Don't put your ideas into there, and allow them to choose their own what are the healing options or their own options in solving the problems. That is very important. And whenever you are using the word, be careful. Word has got a power. Word will manifest. Just don't say that you don't do. You are always useless. You will not achieve. See the other babies. These words will remain in their mind, and it will be working for them. They think that is a failure candidate. Be careful with your communication tips. So after that, it's not only communication. When you do good communication, good discipline is important. Good discipline, it doesn't mean that you be a militarian or a too much of what are the hierarchical pressures or showing you are a boss. Nothing like that. You can express your discipline or your strictness only through your silence. Okay, shouting or just a rage phenomena is a weakness rather than it is an advantage. Always keep your rules and be a role model. Just telling the children not to use the mobile, not to smoke or not to drink in front of them, and you'll be doing it is not a discipline. First, you be a role model and be firm whenever it is when it comes to their safety, their life, their health. Be firm. When it comes to other things, give the chance. Give them the be flexible when it comes to their dress, hair, or their whatever the free time. Be free, flexible. Allow them, but keep monitoring. That is very important. Whenever possibly, give rewards, and whenever required, be withdrawal from the privileges with good information. This about disciplines. What about conflicts? Conflict, it is not that only fighting, it is between within ourselves, inter, or within the society, or within the gang, within the group. It can be anything. So conflict can be solved by thinking. Parents can think in all the things, at least the same skill. Is the conflict is important or the relationship important? Or the relationship is important or the conflict is important? If the subject is important, our life is important. Or the relationship is important. It's like that you make a permutation and combination, then come to the solution. Give the importance for their, let them come out with a whatever the way they can come out of the conflict. Is it by coming out of the situation or solving or mutual understanding or with a hug or acknowledge or accepting the apology or forgiving them. Give a just, they should come out of the conflict, because the conflict can lead to other problems. But during conflict, stay calm and use the proper language. Tone and voice should be good, and you should have a very good communication to overcome the conflict. That's very important of conflict. Then what is risk taking behavior? It is, we have seen that peer influences increases the risk of risk taking behavior of 50%. So we should monitor where they are going, what they are doing, and where else they are moving around. We should know, because risk taking behavior is increasing. That is the where they land up with problem. Common, we know that risk taking behavior is mobile phones, substance abuse, excess dieting, seeing the other heroes or whatever the role model, unprotected sex, bullying, gang violence, stealing, shoplifting. So all these things is taking behavior there. For that, you should be like very closely monitor them, and you should know you should have a connected with your children about what they are doing, and monitoring them significantly is very important. So what is that? What is the tool for preventing high risk behavior? Is know your children's peer group, address them, call them for a cup of coffee, introduce them. Don't demoralize your child in front of the peer group. Make a friendship with them, have their phone number, and be connected with them, and just know who are they going out, hanging out, what are they doing, where they are, when they are at home, how they are doing, how their academic performance, everything know. And please teach them about say no. That is where they we lack them. Tell them if it is no means no. There is nothing like off no or quarter no. They should know to we teach the skill when to say no, when to say yes, and just address them about with a good example what are the consequences of risk taking behavior. And mainly we tell about a lot of busy schedule. We tell working parents, we don't get the playground, we don't get the teachers for the music or anything, nothing like that. If you have a possibility, there is definitely we can do, put them into sports, hobbies, social service, very important. That's how parent, like we can prevent the high risk behavior. Apart from that, what I mentioned was, it is not only high risk behavior and preventing the high risk behavior, and it is very important is it is their physical health we should give important. Apart from mental health, we should address about physical whenever we get a chance. Tell them about the good nutrition and about junk foods, and inform about high fat, sugar, salt, what is their effect, how moderately we should consume. and minimum they should undergo to 30 to 60 minutes of work, physical work. And important thing is, where is sleep is deprived because of the media, net, or whatever it is, and lack of sleep leads to a lot of sleep related issues, physical, mental. Put them into sleep at least 8 to 9 hours they should sleep, and could put them into a lot of study habits, and tell them about the importance of academic performance, and more and everything. If they want to control their physical and mental states, put them on meditation, whatever the kind, whatever the religion says, whatever the silence. Dr. Shashidhar tells about silence, that itself is more than enough. Put them into habit. There, all the whatever the tantrums and other things will come down, and pursue their hobbies. Don't tell them he is not interested, he doesn't go, he wasted our fees, nothing like that. Put them into whatever the hobbies important is, introduce life skills in all the manner, and uh, periodical checkup is very important. Coming to the media, we know majority of the children now 80% of them are engaged, and important is their cyber safety, cyber bullying. Lot of problems are going on. Majority, which same Instagrams, everything is going there. We have seen many attempted suicide because the children, they didn't get so much of likes in from the compared to his friend, all those things. So ensure media where it is, how best it should be used, and we should be a role model. Or telling the children, and we'll be watching the TV or watching the mobile throughout the night, what he will do, he'll tell you, you will be watching, why I should not. So avoid gadgets in the bedroom or in the dining table, and have a fixed timing where it should be used, and please monitor what they are using. Important what they say, what I would like to tell about teens, this thing, their digital wall should be good. If somebody sees later after 5 years or 3 years, in when it comes to their career and anything, somebody watches a digital wall, they'll come to know what's going on with their. Nowadays, in all the recruitment, they see their Facebook or the digital wall. We should tell them. Otherwise, they'll they have their own ism, or political party, or own fancy photos, and that will affect their career. We should tell about them and their safety too. Apart from that, just we addressed about the communication, then the cyber the problems, and the physical health and other things. First and more important thing is sexuality and education. What are the way we should increase it? When a adolescent age, it's very common to have crush. He may come and tell you that with I love this, I like this person, he is very handsome, very beautiful, and he'll be moving at that. And don't deny them, don't get panicky, and don't give then don't scold them or anything. Take this as an opportunity. Tell them what is love, what is lust, what is attraction. That is the best time to tell them what is temporary phenomena, which is not required, what is love, which is develops over a period of time. Address them properly when you get a time. Apart from that, it is not only this kind of education. It tell about the body aging, tell about the menstruation, conception, contraception, which majority of the school, one of the adolescent was telling, whenever a sex education come, they'll get a holiday, or they'll have a midterm leaves, or whatever it is. So they don't get complete education about these kind of sexuality or education. That is very important. Apart from that, to avoid sexual abuse, once again, sex education is very important, and they're very vulnerable. We see a lot of teenage pregnancies and abuse, it's going on. Even men children also undergo this kind of sexual abuse. But very, very important, we should tell them, we should, nobody has right to make them feel uncomfortable, nobody, including their parents. Nobody. We should tell about good touch, bad touch, and especially we should tell how to recognize this problem, what are the flag signs, how to recognize this problem, how to resist. And important is report to the parents, report to the teacher, or the good friend, or to the authorities. Very important. And mainly we should tell all the children about POSCO Act. Very important. Tell about the legality issues, how it is going to help them, as well as how it is going to punish them also, is very important when it comes to prevention of sexual abuse. How about, we are seeing a lot of what we see nowadays, all the metro cities, even the two-tier cities have become, substance abuse is very rampant, where we can, the children will get ganja, whatever the stuff, for 15-20 rupees. They have a WhatsApp group, they'll come and take it, and we can start, we can see at the age of 8 or 10 years they'll start doing it, which is, I think we should have a strict vigilance about that. As a pediatrician, we should be take every opportunity to tell about the how to prevent, how to overcome, how to, peer group conflicts or the peer pressures. And first and foremost, we should the parents how to recognize this warning signs. Means if they are isolated from their activities, coming down from the scholastic performance, losing weight, loss of appetite, or any danger, any spots on their body or their behavior, that's a warning sign. That is the time we should take their help. And this way, professional help is very important. It is not criticizing, harsh word, or blame game. It doesn't help, because these children are going to land up with severe problems. That's why we should put them slowly, bring them up from the situation, encourage physical activities, hobbies. First and foremost is, when you identify this kind of warning signal in science, take the professional help. Very important. So what I want to say, anything is abnormal. Anything, or even Amrita, if it becomes too much, it becomes a Visha. That's how anything lasting for long time, more than 2 weeks, you should think is increasing severity of their loss of appetite, decreased activity, or what they were interested in previously, they lose their interest, or their scholastic performance, inability to do the routine was. That is the time you should give importance that something is going wrong, intervene, do the screening, or take the professional help, and help the child to come out of this problem. That's about parenting. Important thing is, adolescent is, as I said, they are written critical phase. It is a crazy phase. That's what everybody we undergone this phase, and it's a very good phenomena. It's a poem. We should. That's why one of the great poet has written. This is mad phase, but I love that mad phase. That's what they written. Everybody should undergo, but they should sail through this journey very nicely with a comprehensive, smooth life. That is important. Take care of not only physical, mental, emotional, psychosocial, sexual growth, overall comprehensive, complete growth, and life is important. And give importance to love, love, love. That is important. And finally, wish you all happy parenting. Thank you.
Thank, thank you, Dr. Somshekar, for your lucid talk. It was wonderful and confining to time. Our next speaker is none other than Dr. Preeti Galgali. She is the Director and Adolescent Health Specialist, Bangalore Adolescent